Today we'll be talking about the role of telepsychiatry in primary care. My name is Dr. Justyna Wojas. I am an assistant professor here at University of South Florida, Department of Pediatrics, Neuropsychiatry Division. I work at the Rothman Center. I do not have any disclosures at this time. Some of our objectives for the talk today will include ways that you can utilize telepsychiatry in your practice. Learn about patients that are most amenable to telepsychiatry. Identify benefits and limitations of telepsychiatry as the tool of delivering care, mental health, and behavioral health services at your practice. Just a bit of an introduction about mental health illness in general and why telepsychiatry might be useful in your practice. So about 1 in 5 children experience mental illness, and only about 20% of these children receive treatment. Also, there's an average delay between onset and intervention for children, and that's about 8 to 10 years. For families that do seek treatment, about 50% terminate prematurely for various reasons. Usually it's lack of access, financial or transportation difficulties, and also stigma with regards to coming into a psychiatrist's office or mental health provider. Something that you may be aware already, that 70% of children and adolescents with psychiatric conditions are already being treated and seen at pediatrician's office. And the primary reported diagnoses are ADHD, followed by behavioral problems, then anxiety, and then depression. Also, 1 in 5 adults experience mental health illness, and majority of adults with mental illness have onset of symptoms during childhood. Many, up to 2/3 of mentally ill patients, have also serious significant medical conditions that may require and should require treatment from primary care providers. And most of these patients do receive their mental health treatment with their primary care doctors. One should also point out that those that have mental illness and serious medical conditions usually die 25 years earlier before general population. So the importance of working with mental health providers and primary care doctors is very important. One of the factors is that I've mentioned earlier is the disparity in the availability of mental health providers and the rising rates of mental health conditions, especially in American youth. So again, the importance of primary care physicians in treating and coordinating care may become very vital. The use of telepsychiatry for children with behavioral conditions, mental health conditions, as well as adults may be a vital tool for primary care physicians to use, especially in remote rural areas. One might note that in Florida, we only have currently 374 child and adolescent psychiatrists. So telepsychiatry is a valid alternative to an in-person evaluation. This presentation will focus on delivery of mental health, behavioral health services through the use of telepsychiatry. We'll talk about the office, technical setup, selecting an appropriate patient for this type of delivery of care, expectations, current models, available resources, and obviously benefits and limitations of this delivery of care. Some of the definitions before we get started. Telemedicine is a way of providing healthcare services through technology, such as video conferencing. That's what we'll be focusing on. Telehealth or e-health may involve services that are beyond clinical services. Telepsychiatry or telemental health or e-mental health is a subset of telemedicine. It includes services such as direct psychiatric evaluations, range of therapies, education, medication management, can be direct patient care or mental health care consultation to primary care providers. And that has a term for itself too, teleconsultation. Telepsychology or e-therapy are psychological services provided remotely via audiovisual telecommunication or video conferencing. Some of the terms we might encounter throughout this talk are collaborative care, which involves working with primary care. Integrated care involves working within primary care setting. However, in literature and between providers, both terms have been used interchangeably. So telemedicine is a multi-billion-dollar industry. Its mission is to improve quality, equity, and affordability of healthcare. Technologies that are used these days are email, telephony, messaging, electronic medical record systems, web-based applications that your patients might use or you may use, mobile devices, video conferencing. ATA, which is the American Telemedicine Association, offers much information that you may need, offers courses, webinars, and events. They also offer ways for you to connect with different vendors as well. APA is American Psychiatric Association, advocates for psychiatric services to be equivalent to an in-person services. They also offer great practice parameters that are available on their website. ACAP, American Academy of Child and Adolescent Psychiatry, offers practice parameters as well. Some of the background. Video conferencing is not new. It's something that actually got started in 1959 at University of Nebraska. Nebraska Psychiatric Institute provided therapy, consultation, liaison psychiatry, and a way of training for medical students. Massachusetts General Hospital provided psychiatric consultation for children and adults at the Logan International Airport Health Clinic. The key personnel who contributed to the field is Frederick Guggenheim, and Thomas Toyer and Kenneth Bird coined or came up with the term telepsychiatry. Some of the settings or models that you may encounter with telepsychiatry are private practice, outpatient clinics, hospitals, correctional facilities, schools, nursing homes, military treatment facilities, patients' home. They can be delivered via direct care, a mental health provider or psychiatrist directly to those facilities or to patients' home, via consultation, where primary care is responsible for the care and have a psychiatrist or mental health provider for consultation as needed, versus a different variety of collaboration models where you have collaboration of treatment with both primary care provider and mental health provider or psychiatrist therapist. ACAP also recognizes the importance of collaboration between mental health care and pediatric primary care, and they've laid out some pointers for successful collaboration. They believe in consultation, which to allow providers to consult via primary care providers to consult via telepsychiatry. Co-location may be an idea where you have a mental health specialist that works in your office to help coordination, someone that can be trained to help with that. Collaboration, which establishing different partnerships. All of these models should have timely access to consultation, availability of direct psychiatric service, care coordination, primary care education programs, and really attempting to partner with families, communities, able to manage workflows such as crisis or any safety questions, have a way of evaluating your system in place. Sustainability usually refers to financial, IT-wise, and legal and any liability issues. So some of the models what I've touched upon already is you can be contracting with a psychiatrist or mental health provider who's part of a particular telemedicine platform, who's already accustomed to this, or contracting with a private psychiatrist or mental health provider to meet your practice's needs, contracting with certain agencies that offer psychiatric care via video conferencing. You can, why collaborate? Again, it's because to improve health outcomes, there's research to show that it's financially beneficial to the primary care centers. We do know that pediatricians can sometimes bill more for shorter medical visits. So having someone to help you out with the behavioral health aspect of your patient's need may be a good economical business model for your practice. How do you get started? Let's start with the equipment. All you need is a computer, internet connection, and a webcam at both sites, wherever your patient is and wherever your provider is at your site. You may need a printer and a scanner or fax machine if you need any administrative paperwork that needs to be transmitted, such as consents or assessment or scales anything of that sort. Telephone as a backup in case your technology fails. Attempt to have good technology that has clarity and is reliable. Good organization is the key, and it has three aspects: clinical, technical, and administration. With regards to Florida, there's no specific restrictions to related to technology as long as it's compliant with HIPAA. Let's talk about technology. What we think about telepsychiatry, we think back out these dedicated video conferencing units, which used to be bulky. Now they're less bulky and more mobile. There's the synchronous, which is the video connection transmitting in both directions, or asynchronous, where you basically capture the info and then transfer the data or the image via telecommunication to another site for consultation. There are many internet-based free video conferencing that is available right now. Usually they're not recommended as they may not be HIPAA compliant, or you must have certain safeguards in place in order to make them HIPAA compliant. Current trend is towards cloud-based meeting space, and that can provide secure video conferencing platform for a monthly subscription. Some of the platforms are here. They're obviously not inclusive. You might want to reach out to the ATA website and their vendors. Technology, real-time interactive video conferencing software such as Cisco Jabber, Adobe Connect are one examples, but they all must fulfill HIPAA compliance to ensure confidentiality. Usually 128-bit encryption. You're looking for high resolution and fluid picture. You have one example, which is FaceTime. It has claims that it's HIPAA compliant, but something to be aware, the user's wireless network must be connected to a robust, secure network with advanced encryption standard. Skype, usually the free version is not HIPAA compliant, but the commercial version may be HIPAA compliant. When you look at and speaking of different IT or vendors, make sure that you look for a business associate agreement between the clinician and the technology partner, which outlines data encryption measures of the technology partner and have that contractually spelled out. Many practices are moving away from software to utilize vendors that provide HIPAA compliant platforms that providers may use for a monthly fee. So HIPAA compliance is not just the software or the platform, it's also how it interacts with other aspects of your practice, such as electronic health record. The APA has some recommendations on their website with regards to encryption with the Federal Information Processing Standard, 256-bit standard, and that any peer-to-peer video conferencing is not stored or intercepted by the company in any way, meaning any recorded video conferences or text-based chat sessions that are stored locally on your own HIPAA-compliant device or electronic record-keeping system in order to safeguard any electronic protected health information. With technology, you and your device use passphrases and two-factor authentications. Obviously, as mentioned earlier, if storing data locally, they must be encrypted. Have all the latest antivirus, anti-malware, and firewall software, IT support. Be mindful of occasional upgrades, ongoing computer maintenance, availability of e-signatures if needed, audit trails like you would in electronic medical record system of logs to access patient records. Some of the common data breaches are actually done with tablet or USB flash drives because they may store patient information and they're easily displaced, so be mindful of that. With regards to the physical office setup, make sure the room is private, secure, free of distractions and noise, and with appropriate lighting. You may need to purchase a noise cancellation device to help you with that. Make sure that the objects in the room are safe and do not contain items that patients may hurt themselves or others, like needles, otoscopes, things like that. Make sure the room is big enough to accommodate an assistant, a patient, a parent, or somebody else who's providing a collateral information. Use of Wi-Fi is not recommended as it may fluctuate, so consider hard wiring connection. Run the speed test to measure your bandwidth. Upload and download speeds should be above 5 megabytes or preferably above 8. Run what's called the ping test to measure the quality of your existing broadband connection. When you are delivering care, look into the camera versus patient's eyes. This will give you a better eye-to-eye contact with the patient. Sit 2 to 3 feet away from the camera. Be aware of the location of your microphone to minimize distracting noise, such as if you're typing a note, flipping through documents. Be aware of that it might be close to your microphone. Appropriate lighting is important. Try to avoid shadows or having a window behind you. If you do, have the blinds drawn. Have a video system that includes both your image and of how you appear on the screen, so you know how you appear. Consider having 2 screens, especially one for electronic medical record system and one for your platform that you're using to do teleconferencing. Give time for the patient to reply. Extra time will be needed for telepsychiatry visits. Dress professionally, just like you would in any kind of medical visit. Try to avoid distracting patterns. So these are hints for your consultant that you can give, especially if you're contracting with that you might discuss, or if you're giving telemedicine yourself. Be mindful of the view that's in the camera with regards to the office setup, and keep the background neutral. Delivering care through telemedicine needs to meet standards that are equivalent to an in-person service. So if you have a patient coming in through your office, you would do informed consent, either verbal or written, depends on your state, just like you would with any other patients. If you have mental health providers or psychiatrists provide services directly to the patients at their home, you would have them show their driver's license ID card and plan ahead with either written or verbal consents. Pre-planning is crucial when doing telepsychiatry. Make sure that you have toys that the mental health provider will need to see how the child engages with them. Also occupy their time. If mental health provider needs to speak with the parent or anyone else coordinating care, as these consultations may be a little bit longer than the medical visits. Foresee any language barriers or hearing limitations. Have a camera that allows wide angle and close-up. There is some physical examination that may need to occur in a behavioral health, mental health visit. So gait, strength. A lot of times when the children or adults are on medication, you're assessing for rigidity of joints, extrapyramidal symptoms, tremors. So it will be helpful to have a trained staff, a medical assistant that comes in with the patient to the room that may be able to assist your consultant with this requirement. Again, we touched upon it before, but there's different models. Direct care, where the psychiatrist manages your patient directly at your office or at patient's home. Consultation, where you seek out help with certain patients, or a different variety of collaborative care models where a psychiatrist may intervene several times during the care of the patient. Special considerations. If you foresee an agitated person, assess that. Assess the risk to the patient and to the staff. Sometimes content during a mental health, behavioral health assessment can be of a nature where it might be upsetting a patient. So plan ahead is the key. You definitely need availability of professional staff in case of crisis or in need of involuntary hospitalization, whether that be availability of 911 that's close by that can correct a patient, or a professional that has the capacity to do a professional certificate, or if you have a patient already on medications that you know might be used to help calm the patient down if it's an established patient. If you have a staff that's able to calm the patient down in a quiet, safe place, you might need a staff to sit with the patient if the consultant needs to speak with the parent or caregiver privately. Definitely the algorithm of safety and crisis needs to be planned out with your consultant, with your team prior to initiating services. Also, have clear guidelines on acceptable methods of communicating with the provider, whether it's some kind of patient portal, emails. Again, pre-plan. Know what you're going to need for the visit. Know your patient. Know who your consultant's going to need collateral information from, so have them available during the visit. Know what office staff you will need to assist with the visit. Know your community resources and emergency services. Have a clear referral question that is feasible, that a psychiatrist or mental health provider can address in that visit. Make sure that if for some reason the care can no longer be managed safely by telepsychiatry, you have other consents in place for treatment. With consultation especially, each party has to identify their role, their title, what their responsibilities are, how they're going to be involved in the treatment and the diagnosis and care. Know all the resources around the patient and current events where the patient resides, as your telemental health provider may not be from that area. Rural areas, remote areas have been studied, especially in Australia from 1990s. They show good satisfaction, validity, reliability in comparison to in-person services. You do have to make note that local services like support staff, psychiatric emergency, inpatient settings may not be readily available. There may be a long travel distance, something to think about with agitated patients. So again, the planning will be crucial in these areas. Credentialing. There's usually a relationship between different hospitals with regards to providing credentialing information. Provider must be licensed in the state where the patient resides. That includes the mental health provider. Exceptions include the VA and Indian health system. With regards to controlled substances, there's a Ryan Haight Online Pharmacy Protection Act. Basically, it required providers to conduct an in-person medical evaluation at least once every 24 months to prescribe controlled substances. However, Florida Board of Medicine upheld the ruling on allowing controlled substances to be prescribed via telemedicine for treatment of psychiatric disorders, and something that's new, MAT, medication assisted treatment, that was communication provided through DEA on May 15, 2018. DEA wrote that registered practitioners acting within United States through telemedicine that practice according to the requirements of telemedicine are allowed and are exempt from in-person exam when prescribing controlled substances. With regards to documentation, something to keep in mind, you need the time, date, sites of where everyone's located at, the time you spend during the encounter face-to-face, all the providers that are involved, and the usual notes, which for psychiatric notes includes chief complaint, referral sources, HPI, current medications, past psychiatric history, mental status exam, diagnosis, treatment planning, review of assistance, past medical history, family history, and social history. So providers, who are good providers? Something to think about when you're looking for a relationship with a mental health provider, psychiatrist to deliver care to your practice, to your patients. Someone with background in acting, public speaking, coaching, video conferencing, or broadcasting are great. But if not, people can get better. You practice and observe yourself, ask for feedback from patients, from colleagues. Someone who's really focused on patient-centered care. Someone who's really aware of the consultation question, someone who can pre-plan, is well organized, and obviously all the providers who have an emergency plan in case of escalating behaviors. Reimbursement. Florida does reimburse for telehealth. Here are some of the CPT codes that are related to psychiatry. The APA and the ATA website both provide a map with regards to states and their parity laws, which refers to legislation to mandate that private insurance cover telemedicine, so you can refer to that. Medicaid program does reimburse in 48 states to some degree, and Medicare and does in areas considered remote rural. What are good candidates as far as patients for in-home telepsychiatry services, so directly at their home? Those are patients with huge behavioral problems that might pose difficulty to having services done at the site. Those with severe autism or anxiety disorder, or physical limitations, who are unable to come to a center. Patients that are good candidates for center-based telepsychiatry, so those who come to your office and then get services via telepsychiatry. And those are with diagnosis of depression, anxiety, even psychosis. Unlike what we earlier thought that patients might become paranoid with the video cameras, they're not, as long as they're not agitated. Substance abuse patients, ADHD, personality, mild behavioral problems, geriatric and child and adolescent population, PTSD, tics, and OCD. We do know that treatment of depression and in primary care setting using collaborative models via telepsychiatry is more efficacious than usual care, but less than in-person psychiatric services. So if you have a patient that is receiving treatment for depression via telepsychiatry and they're not improving as one would expect or getting worse, you may need to consider then an in-person psychiatric patient centered treatment. Also be aware of who you are comfortable with. If you are doing strict consultation only where you are managing the patient and only having 1 or 2 visits, that patient's only having 1 or 2 visits with the psychiatrist, you maybe want to select which patients you are comfortable managing. Any patients that's obviously very high risk that needs immediate attention may need to be stabilized first before resuming services at with your care with telepsychiatry. So something that be mindful of what you are also willing to prescribe and manage with the help of the mental health providers. Why collaborate? Again, there's a lot of literature to support that improves outcomes, especially family patient satisfaction. Tends to be more theholistic approach because you get that collaboration between the two, your medical needs and your mental health needs. Be mindful that there's literature to support that some brief interventions may be sufficient for anxiety, ADHD, and ODD. You can do some brief treatments, brief psychotherapy that you might be able to get telepsych to provide, and your patient may get better in just a couple sessions. So you may need to reduce the need for long waits and having patients suffer with some of these symptoms. It definitely reduces the need for a long wait time to find and travel time to see specialists. It really allows for that patient family-centered care. Academy of Pediatrics does understand and realize that primary care clinicians have strengths and skills to identify and treat unmet mental health needs in youth. They're very confident that primary cares do a great job and that they can coordinate with mental health professionals, schools, public agencies to really help change the framework and reimbursement of how we practice medicine. So the American Academy of Pediatrics did form a task force on mental health. Some of these special population, we touched a little bit upon it. One is geriatric. You do need to make sure that during those visits that the mental health provider has some sources of information. Be aware of any vision, hearing, or physical limitations. Geriatric population may be coached how to use telepsychiatry and can do it well, but if patients with severe dementia may need assistance with that. You may be able to deliver care right to the nursing home so as to reduce the amount required for wait time, faster delivery of care. It also allows for all the parties to meet to kind of do more multidisciplinary approach. The caregiver, everyone can sort of meet and come up with a good treatment plan for the patient. Something that is already widely used, school-based, obviously directly to school. can really minimize parents' disruption from work schedules, faster delivery of care. So again, we touched upon it a little bit. For your patients in your private practice, your clinics, that center-based telepsychiatry, those that are not a good fit are those that are agitated, severely disruptive, or delirious patients. Those that for some reason are unable to engage in technology, usually those with severe intellectual disabilities. If you're trying to do especially a new developmental delay evaluation, it really needs that one-on-one interaction in person, or someone with dementia. And anyone that's requiring a higher level of care that you anticipate throughout the visit might escalate, might not be a good fit. Different types of therapies that have been used through telemental health are group, individual, and family, cognitive behavior therapy, interpersonal therapy, exposure therapy even, dialectical behavior therapy, psychodynamic therapy, and obviously we talked about medication management. Benefits: it improves access, especially in rural areas, and decreases delay in care. It really integrates mental health and primary care to improve patient health outcomes. It reduces barriers such as stigma. People are no longer needing to show up at a certain office and be associated with certain diagnoses. It reduces the need for transportation needs, traveling to far providers, and it reduces costs. It has been shown in most cases to be equivalent to an in-person care with regards to diagnostic accuracy, care, and satisfaction. So what are the limitations to telepsychiatry? Well, there are limited technical issues that you may experience, such as usually related to low bandwidth. You may not be able to, the consultant may not be able to smell alcohol or be able to assess extrapyramidal side effects themselves, so they will need a trained nurse or an assistant on the end that the patient is at to do this for the provider. Cognitive assessments may be difficult. It's really not recommended for evaluating for autism spectrum, especially new evaluation. Those are preferred with in-person assessments. And it does take longer. With regards to malpractice, psychiatrists are required to have malpractice insurance that includes coverage for telepsychiatry. Many current insurance already include that, or you can buy supplemental. Here are some of the resources that are available for you. There's websites. The American Association of Child and Adolescent Psychiatry, ACAP, has developed practice parameters in 2008. The American Telemedicine Association, ATA, provided guidelines. These are some of the dates: July 9, 2009, October 2009. There are new practice guidelines which are very concise, easy to read. I encourage you to do so. And that's practice guidelines for telemental health, video conferencing, and they were released in April 2018. The APA website has a base toolkit that helps you with some of the logistics on how to set up this sort of addition to your practice. And there's also an article there that was released in 2014. If you are really thinking about doing telemental health or telemedicine, becoming a member of ATA might be a good idea. Much of its resources are available with their membership, and that way you can get more access to different vendors, IT questions. You can also chat with other providers to see what has worked best in their practice as well. This is some of the PubMed search that I have done. That will conclude our talk for today. So I will leave to any questions.
Video conference options allow for saving PHI or the conversation. What may be issues with agreement costs of retrieving the data, perhaps if one changes to another video conferencing provider?
Can you clarify the question? What cost if you're changing a platform? I don't think I fully understand the question.
Then I'll go ahead and read the next question here.
Okay. Maybe you can clarify exactly. I'm not familiar with the costs of changing. I think that's a good question to ask vendors.
What are challenges with video conference related to payments, insurance coverage, or uninsured, undocumented, etc.?
Okay. So we talked about the CPT codes that are covered there on the slide that are already, there's a map depending on what state you practice. There's different parity laws with regards to getting insurance to pay for it. You self-pay, you can have a contracted rate that you can charge patients, or you can agree with your consultant upon. So there's different variations of how people have set up their practices.
And then our next question says, would you happen to have a list of telepsychiatric providers in and around the Orlando, Florida area?
So you can go on to, I've listed some of the platforms there. I guarantee you, once you start searching on Telepsych, I've received many emails directly to my email account soliciting me to different providers. So there's already established platforms that if you go on their website for providers and patients, that you can get different quotes. Usually what happens is that telepsychiatrists, teleproviders do not necessarily have to live in your area. That's the beauty of telepsychiatry. They can be located in a different state. They just have to be licensed. So many of these telehealth providers usually will have several licenses in different states, so that way they can provide services and accumulate patients, clients. So it's I would check online to one of these services, or if you have a partnership with a psychiatrist that's that you like using, then you guys can talk about maybe starting up the psychiatrist or this psychologist some services. Already a lot of the practitioners are incorporating some form of video conferencing, especially for follow-up visits in their own practices. So they may be able to extend that to provide services to your clients that are established in your practice, or provide consultations to you.
Okay, the next question here is, in Florida, can clinicians bill for telepsychiatry services, or is it only MDs?
I was under the impression that both ARNPs and psychologists and psychiatrists may bill for services via telepsychiatry.
Okay, we're caught up on the questions.
Obviously, you can clarify that with the insurance company that you're contracted with, but currently many of the providers are especially some of these vendors that are and platforms, they have nurse practitioners, psychologists, and psychiatrists that are delivering services through that method.
We got another comment. Thank you. Great talk. I can see that telepsychiatry is great for the patient, but may cost the specialist extra. I am a PCP. Does insurance allow extra?
Extra to you, I guess originally there might be some costs with regards to the setup. You can still bill for the services. Yes, there will be an extra time that you'll have to spend with the patient, but overall, it will probably reduce the cost for you. Because if you have a way that you set up your office and you streamline it, where you have, and sometimes it doesn't require a lot of training, a medical assistant that you train in case of emergencies and how to figure out your flow of your practice, it can actually greatly save you time and energy. So if you already have something in place, you're not spending all the extra time trying to find out where to send your patients, having the patients come back to you for certain visits that you might not be optimally billing for. So yes, there are some startups, but in the end, especially if you have a big practice, it will save you time and energy if you establish a relationship with telepsychiatry. So kind of streamline the way you treat your patients. So.
Okay, I think they typed in a little bit more here. Does the insurance allow extra charges to be paid to the psychiatrist?
I would have to clarify on that. I think it depends on the CPT codes that you are using. Let me go back to the slide. It's going to be dependent on the state with the parity laws. With regards to Florida, are you referring to like the 305, the extra 30 minutes, 1 hour for the psychiatrist time? I'll have to look into that for you. There's also variations between even when you do in-person extra time on which insurance companies will pay for that or not. Sometimes you have a contracted rate with them. So that even it becomes variable to even in-person exams and what each individual company will pay.
This viewer here is asking, are you planning on setting up with the CMS Clinics?
So there's something in the works that we're trying to set up with regards to providing some consultation to some of the remote rural clinics that do not have access to mental health providers for their clients. So that's something that we are actively working on to maybe service some clinics that with special need in rural areas to be able to help the pediatricians. So
okay, and our next question, in pediatrics, there are some insurances that make us bundle services. I think that is where we are concerned about whether we get charged for the visit out of our services.
Okay, I'll have to get back to you because my billing as a child psychiatrist, so for those related to the mental health codes, medical codes. So I'll have to get back to you on that with the bundling.
And then I think this is more of a comment, but it says perhaps someone can work on a grant to assist psychiatrists in underserved areas for startup expenses.
Good idea.
What about setting telepsychiatry consultations with a primary care provider regarding ongoing treatment of a patient? Yeah, that would be great. I mean, you can either treat the patient or you want a psychiatrist to do a consultation only or some follow-ups if just to assess where the patient's at, if there's any other services versus some sessions with the psychologist to optimize the treatment that you're already giving with medications for the therapy part. Different models have been used. So you have to decide what would be the best use of your time and what you feel comfortable with treating and what responsibility you would like to assume versus collaboration model or the psychiatrist delivering all the care or just having periodic consultations and you managing most of the workflow. I love the last comment. I think Massachusetts has the model.
Yes, they do. They have a model that's in place that they do have an algorithm to assess what type of patient, what needs may be, and then patients kind of gets triaged. A lot of times it's a tele kind of psych conference call between the provider and the mental health provider. There may be some options for seeing a patient via actual telepsychiatry visit, but so there's different variations depending on the needs of the patient. Obviously, use of facilities for those who need higher risk of care to streamline those that may need in-person as vital. So I think they do provide a lot of the models for collaboration and telemedicine. So I just wanted to make you aware that there are different hotlines there, that Florida Pediatric Psychiatry hotline is there, that is free, available to pediatricians. The number is 1-866-487-9507. So that way you can, if you have any questions and you want to speak with a psychiatrist, then they can help assist you with any questions that you might have about new medications regarding a patient you're treating. I have been involved in the pediatric consult line via the telephone services, so I may have spoken with some of you already via phone. Just want to remind you that that is currently up and running, so you can utilize that until we dive into the world of telepsychiatry with video conferencing.